car accidents, wrecks, crashes, whatever you call them. The result is people get hurt. I'm Ed Berstein. If you've been hurt in an accident, call me.
Turn to someone you can trust. Enough said. Call Ed.
Well, if your New Year's resolution is to improve the way you look, this is the man you need to talk to, Dr. Jeff Roth, who's a cosmetic plastic surgeon. Now, what is the term of art now? Some doctors refer to themselves as cosmetic surgeons, other plastic surgeons.
Sure. Anyone can say that they're a cosmetic surgeon because your license says medical doctor and surgeon. So, but basically, plastic surgeons are those people that say that they're plastic surgeons. You want to look for a board certified by the American Board of Plastic Surgery. Those are the folks that went through the rigorous training programs. They did a full university-based residency or fellowship in plastic surgery and have passed rigorous boards. But the bottom line is anybody can say that they're a cosmetic physician or cosmetic surgeon, but of course my bias is to go to somebody who's board certified by the American Board of Plastic Surgery.
Right, and that's the #1 message that you hear about plastic surgeons. Go to somebody board certified. Where did the term plastic ever come from?
Plastic actually has been around for a very long time. It's from plastikos, which means to shape or form. So plastic surgery has been around much longer than any of the plastics that we see. In fact, it was around before the time of Christ. There's been a few papers that they found that ancient Indian folks were going ahead and moving tissue around. Because in India, when you were a criminal, they would cut your nose off, throw you in jail. When you came back out, you served your time, but you didn't have a nose, so nobody would hire you, nobody would interact with you. So at that point, they devised a way to go ahead and cover your nose back up again with soft tissue. And so that actually has been around for about 2,500 years. So plastic surgery in of itself has been around for a very, very long time.
Hey, it worked for Michael Jackson.
Sort of, yes.
So, hey, it's changed so much. I mean, you were born in Las Vegas, grew up in Las Vegas, now practice plastic surgery in Las Vegas, and I'm sure you have seen it change in the years you've been here dramatically. I mean, Las Vegas at one time, and probably still is the breast implant capital of the world.
Yeah, so absolutely came up, went to Chaparral High School 100 years ago when there was only 300,000 people in town. You were here, you know the explosive growth. Las Vegas, as you know, has always been a glitz and glamour capital, and part of the currency of that, of the glitz and glamour, is breast augmentation. Las Vegas are always in the top 5 as far as number of breast augmentations done. Rounding out the top 5, Los Angeles, New York, Miami, Dallas. Per capita, we're probably #1. But having said that, the board-certified plastic surgeons in Las Vegas, and there are lots of really good ones, they do a tremendous volume. And as a matter of fact, when the Las Vegas guys, go to the national meetings, we sit through lectures, and some people say, well, I've done X amount of breast augmentation surgeries, or breast augmentation with lift surgeries, or any sort of breast surgery, and they put up their numbers, and our numbers are usually much higher than theirs, just because we have the experience to do that.
Yeah, and it seems like you go to different parts of the country, and people are engaged in certain types of looks. I mean, whether it be breast augmentations in certain parts of the country, some of the cities you mentioned may be different than the popularity in Idaho, for
Absolutely.
instance.
There's a huge difference in the aesthetic, if you will. If you're a soccer mom or yoga mom out in Santa Monica, for example, you may just go from an A to a B so you don't look like a boy. In that particular case, that may change your approach. It may change the style of the implant. It may change the projection of the implant. And again, as most guys will do it, they really try to individualize for that particular patient and their lifestyle. So you're absolutely right. The aesthetic in one place may not be the aesthetic in somewhere else.
Let's talk about some of the procedures that you commonly do today, because Now you have it on the table here two products. One is everybody kind of knows about Botox,
Sure.
although I don't think a lot of people really understand it. And this other one is called Juvederm. Now, these are what are known as fillers.
Yeah, well, basically, these are things that in the past we really didn't have. We had facelift and we had nothing. Now, coming out 15 years ago and even more recently, we have things that can modulate the face that we don't have to go to surgery. So, for example, Botox is basically a medicine that you put into the muscle. The muscle stops moving so much, and so you lose the line on top of that. And so basically, it's a medicine made from the botulinum toxin, but it's the very, very tip of that with very few proteins. They replicate that protein up, and that's the medicine that we go ahead and put in the face.
So, let me stop you there, because it's the muscle that causes the wrinkles?
Many things can cause wrinkles, skin damage, etc. But what you're using with the Botox for is to go ahead and stop the wrinkle when you fire the muscle on top of it. Right. I like Botox for the upper part of the face because the muscles in the upper part of the face lend themselves to it.
Upper part being where?
Upper part basically being from the cheekbones upward. Okay, because you have larger muscles there. The orbicularis oculi, which is crow's feet, the frontalis muscle, which is the forehead, and the glabella area, which is the area between your eyes, is the corrugator and procerus. That's a little technical, but basically they're bigger muscles of the face that lend themselves to being blocked by the Botox. Now, you don't want to overdo it, and I think that people have seen their colleagues with some dropped brows and such. You really have to go to somebody, in my opinion, that does a history, ask you about bleeding problems and neurological problems, and does a physical exam, because oftentimes you can see that, hey, if I take out the frontalis muscles, he or she may drop the brow, and you want to be very conservative. You don't want to do that. So again, go to somebody who's well-trained, somebody who has some experience. And
overuse of it will result in you losing some of those character lines that people call them.
Sure. We get a lot of folks that want to be freshened up, but they don't want to look plastic. So the art of this as well is to have someone still be able to emote, still be able to have some facial expression, but still you kind of calm down the lines for them a little bit. So again, that's where the art meets the science in plastic surgery, and for me, that's what makes it really exciting.
But I guess if you inject Botox in the wrong place, you can really have some significant problems. I know your face is full of muscles, sure, and where you inject it and how you inject it is, sure, is a skill.
You have to be careful, and again, proper training and proper expertise is important. For example, if you get a little bit too close to this particular muscle called the levator palpebrae, you may have a drop in the lid. So that's why you have to have sort of a safety zone, if you will, a centimeter up and a centimeter away from it, so that you don't get that muscle. So again, you have to understand the anatomy as well as the physiology to apply the treatment appropriately. But that's the same in all of medicine. So, and as far as the Juvederm goes, I like that for the lower half of the face, from the zygoma down, because now you have lots and lots of little muscles in the face, so it's less amenable to the Botox treatment. So this typically lets you fill in lines, wrinkles, and crinkles. And before, we had collagen and we had other modalities, and all of them were very good, but this one, it happens to be one of my favorites because I think it's pliable, it's soft, it moves well, and also they put lidocaine in it, which is a numbing medicine, so it takes some of the pain down as well.
Mm-hmm. So how long does the Botox last?
Typically, the Botox will last about 4 months. Now, if someone is hypermetabolic, meaning that they're in the gym twice a day or they're running marathons, it tends to last less. Also, if somebody is very expressive, mm-hmm, VIP waitresses or actresses, they tend to break it down a little faster, but typically 3 to 4 months.
And what is the approximate cost of getting Botox?
It depends on where you go. Some folks charge by the area, some folks charge by the unit. Mm-hmm. Typically, I think in the office we're between $300 and $500 an area. Mm-hmm. Don't quote me on that, but I think we're somewhere around there.
And it's based on what you're injecting, how much you're injecting, where you're injecting it.
Yes. So yeah, everybody does it a little bit differently in their office, mm-hmm, but for us, that's how we tend to work that out.
Mm-hmm. And okay, so the Botox stops the muscle from moving as much, whereas the Juvederm, and I guess there's some other products that are very similar to Juvederm, that doesn't affect the muscle, but it just adds bulk under your skin? Or?
Yeah, a couple things. The Juvederm can be used in a variety of ways, and this is your filler category. The Juvederm is a type of filler that's called a hyaluronic acid, and what that means is if you take an eyeball and you look in the middle of the eyeball, that clear stuff, that's the type of thing that Juvederm is. There's also such things as Radiance, which is calcium hydroxyapatite, which is basically bone, which is also a very good product. And then there's also Sculptra, which is another good product, but that's used basically for volume. So it depends on the anatomical landmarks, the anatomy that you want to change, what your choice of filler is. Now, getting back to the Juvederm, I like it for a couple things. One is I think it fills in wrinkles very well, and what you want to do is basically fill in the valley so you don't have as much shadow. So I like it for that. Juvederm I also like as a filler for the face, meaning a volumizer. And as we get older, we notice that we lose volume in the face. In fact, we lose bone in the face over time. So now we plastic surgeons have realized that it's all about putting volume back in the face to try to give a youthful appearance.
Right. At one time, I thought the science was really actually reducing. I used to pull the skin tighter and tighter, and now it's
absolutely. I think plastic surgeons thankfully have learned in the 70s and early 80s, I'm sure you know, is we used to do buccal fat pad reductions, and some women would go and get their molars pulled because they want that twiggy, very, very thin, like Zoolander, I guess, type of look. Right. We have now gone back, taken a good hard look at that and said, you know, that may very well have been a mistake. Now it's really about putting volume back in the face.
Why does your face lose volume as you age?
A couple things. One is the structure of the face tends to collapse down. The fat gets a little bit more attenuated, and the elasticity of the skin also loses its elasticity, so it decreases. The other thing too is structurally, again with the bone, the framework also contracts, so it's no surprise why things start to fall and things start to get a little bit looser. Mm-hmm.
Now, can you use these fillers in other places other than the face?
Yes, some guys and gals, plastic surgeons, have done that. We've used Juvederm for scars and other places, again, to give volume or to bring out an area from a concavity or a valley into something that's a little bit more flat.
And the Botox also has other uses. I heard they use them for clammy hands or something like that.
Yeah. So what you're talking about is excessive sweating in the armpits, hypohidrosis. Okay, fancy medical word. What that means is your pits sweat a lot, and especially here in Las Vegas, we have really treated a number of patients, and they love it. When I was in California, in Los Angeles, we used to do that for the red carpet girls a lot because they had a $10,000 dress on. They didn't want pit stains, so they would come in for Botox in the armpits. Men here in town, they're wearing suits and they don't want to do that.
Outside.
Oh, absolutely. And I've had a couple guys tell me that, hey doc, this is the first time I've worn a powder blue shirt in decades. And for that, it's been really effective. It's been nice.
And some physicians are using this now for headaches, aren't they?
Yes, there's actually FDA recently approved Botox, not cosmetic, but Botox therapeutic for use of migraines. Now, there's 20 different ways to get a migraine, and your family practice guy or neurologist guy would be better suited for that. Having said that, we incidentally have treated wrinkles and have helped people with their migraines and their headaches.
And that's how I guess they learned about it. This is all by accident, right? You try to resolve a wrinkle problem, and all of a sudden somebody's not getting headaches.
Well, medicine is like that. Medicine, you go ahead and you take a look at the side effect. In fact, Botox was originally put out for strabismus or somebody or blepharospasm. The oculoplastic guys were using it, and they found that the wrinkles were decreasing, and they said, well, hey, look at this. So sometimes it's fortuitous to keep your eyes open and see what side effects you can use for the betterment of your patient.
Yeah, and I guess the good news and the bad news of both these products is that they're temporary, so they will go away eventually. Bad news is if you like it, you got to
Right. The
You
good
get
news
repeat treatments.
The good news is
Yeah.
it doesn't last forever, and the bad news is it doesn't last forever, which is for the face is good, in as much as the face changes, as we talked about. And so to put something permanent in the face, in the dermis, I think is a bit of a mistake, because the soft tissue will change around it. Oftentimes what will happen is then whatever is harder will extrude or look funny. So, and you never want to look funny. So this stuff here, I think, works well. Again, the good news is it's not permanent, and the bad news is it's not permanent.
It seems to me that a lot of this is unregulated. That, I mean, you can go to day spas and have non-physicians inject these kind of fillers and Botox. And then I guess we had some issues in Las Vegas where somebody came in for some procedures and the person wasn't licensed. And what happened there?
Well, yes, this is a national or international trend, which is horrifying to plastic surgeons. And these sorts of things have happened in major cities, Los Angeles, New York, Philadelphia, here, Phoenix, Miami, where unlicensed folks are putting in either Botox or Juvederm. Where they're getting it from, sometimes that's dubious as well. And they don't have the knowledge, in my opinion, of the anatomy and physiology, and they also don't know how to, one, avoid complications, or two, treat a complication if it arises. Right. It ain't as easy as it looks, and that's why you train so hard and have the experience. Here in Las Vegas, we've had a couple incidences more recently of somebody doing eyelid surgery on a dining room table, which is, again, horrifying, and especially getting back to the fillers, we've had that one poor lady who wound up dying in an unregulated clinic behind a tile shop. These folks were not licensed practitioners. They were from Colombia, actually. They didn't have any sort of licensed sterile technique, who knows. But what happened with that lady is she went in to get injections in her buttocks. Typically what happens there is, if you have a problem, it's going to be an embolus, meaning the substance that you put in there. And again, some of these substances that they're putting in are not medical grade anything. It's silicone that you would get at the Home Depot. Recently somebody went ahead and put Fix-A-Flat into somebody's behind. So, so that's the usual. What happened here in Las Vegas is the coroner came back and said actually she died of lidocaine toxicity. What the practitioner, if you want to call him that, did was he's used a lot of lidocaine to try to numb up the area, and it was too much. She didn't have the proper monitoring. They didn't basically treat her correctly, and she wound up dying of the lidocaine toxicity.
And you would think that lidocaine would be harmless. I mean, it seems so innocuous, you know, by itself. But
Sure.
It's the first case I've ever heard of really somebody dying from
Lidocaine's a great drug, and especially the way that we use it to numb little things up, to sew people up in the OR or numb people up in the office. Great drug. But if goes intravenously, or if used in lots and lots of volume, can be toxic. You have toxicity with that. What sounds like, and again I wasn't there, this guy did, is she was probably having pain, and she didn't have pain medicine. She didn't have an anesthesia machine, so it was all under this local, and they kept giving local, and they got in trouble. They went over the threshold.
Jeez. It's, what about scars? I mean, has the science of scars changed over the last 10, 15, 20 years? And while you're answering the question, does it make sense to, let's say you're going in for an optional surgery, or something that you're planning to have a certain surgery that may result in some scarring. Does it make sense to have a plastic surgeon there to stitch you up?
We get this question all the time, and I think one of the evil characters in the Disney realm, I think Lion King, was Scar.
Right.
So yes, Scar is evil, but it's a necessary element in wound healing as we know it. There are some very smart guys that are trying to figure out scarless wound healing, and if you're a fetal sheep, they have that worked out. But as far as being a human walking around the planet, not so much. When you go through,
we have less hair to cover it.
That's true. So, so when you go through the dermis, your body will go ahead and make a scar. As plastic surgeons, we try to hide them in lines, wrinkles, and crinkles that one that normally has. You also, in the conduct of the operation, want to handle the tissues well, and you also want to have not very much tension on the wound when you're done. So typically we try to close things in layers to take the very top layer to have no tension. Now, having said that, There are things that you can modulate scars with, again, taping them for a while to take the tension off, and then in our office and in plastic surgeons' offices, we have some scar creams that tend to help things as well. Smoking is another tremendous detriment to proper scarring and proper wound healing. Now, to answer your question about having the plastic guy come in and do his magic, I think that a lot of the surgeons nowadays, orthopedic surgeons, cardiothoracic surgeons and such, I think have much more of a consciousness, more than they ever did, that yes, they're performing their magic on the inside and they're saving lives or giving mobility back to folks, but patient also likes to see a nice scar. So most of them have kind of changed their MO a little bit to give proper scars. If someone really wants us to come, yes, we usually talk with the other surgeon and coordinate things, and sometimes we get requested for that.
And what about at home? You know, your kid, you know, falls down, they bruise their knee, they get a scar. The old thing, you know, put some vitamin E on or some, you know, other. What type of cream does work?
Right. Well, typically any sort of any wound healing, you want, you know, the basics. Again, you know, non-smoking, stay out of the sun, take tension off of it. When it comes to kids that fall down and hit themselves on the table, they get stitched up. Typically, again, you want to keep it out of the sun. Hard to do with you know, a 3 or 4 year old, you know, running around. But then also sometimes you do have some scar creams that you can put on them. They're usually silicone based. They usually also have a little hydrocortisone in it, which goes ahead and kind of takes down the angriness. Scars typically look their worst at about 4 months and then better again at about 10 months. So another part of the whole scar thing is tincture of time. And so oftentimes we'll do a scar and then people will come back 3 or 4 months later and go, hey, this is a little more red, a little more raised. And the answer is yes, it is. And then we show them pictures and stuff, because that same scar at 10 months or a year typically is much smoother and much flatter.
What about the advantages or disadvantages of putting a Band-Aid on? I mean, I hear contrary opinions on that. Sometimes they say, hey, leave the wound open, let it heal overnight. But now I just read somewhere, no, you should keep it closed at night.
Typically, the thinking on that is wounds like to go ahead and heal up in warm, moist, antibacterial environments. So in other words, a little bit of bacitracin or triple antibiotic ointment, doesn't have to be fancy, it can be the store brand at your local store. That's fine to go ahead and basically kind of keep it moist and usually covered. Now, here in Las Vegas, where things are hot, sometimes the skin will start to get kind of wet, macerated. At that point, it's time to kind of let it dry out a little bit overnight and basically just kind of see how it goes. The main thing is to look at the wound, keep it clean. Soap and water is great. Peroxide, not good for wounds. Good for the very first time, bubbles off the blood, great. After that, soap and water, little bacitracin or triple antibiotic ointment, Band-Aid, and you should be fine.
And what about burns?
Burns, very important. Don't ever put a butter on a burn because it keeps cooking it. And you're a Philly guy.
Old wives' tale.
Oh yeah, you're a Philly guy. I used to work in the burn unit down at St. Agnes, which was the burn unit for Philadelphia. So we saw a ton of stuff. Having said that, yeah, no butter on the burns. It keeps cooking it. Ice cold is key. Even running it under a water fountain or your sink with ice cold water is great.
But not ice, right?
Yeah, ice is okay. Ice is okay. Usually you wrap it up in a little baggie, put a little paper towel on it. What you want is cold. You want to stop the burning process. After that, you take a good look at the wound and see if you need to go get medical attention. And don't hesitate to go to a quick care or an emergency room or a plastic surgeon's office because sometimes things will look okay and then over the next couple of days you may have blistering or something worse. And so always better to get somebody to look at that.
Breast implants, we talked about that earlier. There was a time period where everybody got silicone breast implants. Then the FDA stepped in and some of those products were pulled for a number of years and people are getting saline. And now the silicone has been reintroduced. There's certain uses of silicone breast implants that are now authorized by the FDA and improved from what they used to be. So what are the pros and cons of using those two products?
Sure. First of all, I think silicone implants are safe. It's the most studied medical device that we put in the body, more studied than heart valves or defibrillators, etc. They got a bad rap back in '92 and '93, and it since has gone through its process. There's an Institute of Medicine study and more than 400 peer-reviewed studies that all show that there's no cause between silicone and all of the alleged bad things that silicone would have caused. As a matter of fact, silicone never really went away in as much as diabetics still take 20 to 40 grams of silicone a year with all of the injections they have to give. The new silicone implants are actually really nice for a few reasons. As they develop them, and as we go on in time, cars get safer, implants get safer, etc. The new silicones are really nice because they're much more of a cohesive gel, like a gummy bear. And so nowadays you can actually poke a hole in them or even cut a pie wedge out of them, shake them, and nothing will come out. Their leak rate is also much decreased. The old leak rate back in the day, like you were talking about, the 80s, the silicone implants had a leak rate of 50% at 10 years. The new leak rate, depending on who you talk to, is between 3 and 5%. So much less leak rate, much better implant than that. Even if they do leak, the new implants are designed so that they don't come out of the shell that they're in. And even if they do get out of the shell, as you and I talked about, is basically the body typically walls off the implant in a capsule anyhow. And so usually you have this intracapsular leak, but usually the body just, it's a benign entity, the body never sees it, and usually things are fine. So to answer your question is yeah, these new implants, which got back on the market I think about 5 to 7 years ago now, they've enjoyed a good safety record. They periodically go up for review in front of the FDA panels, and they keep getting reapproved.
And aesthetically, what do you prefer, the silicone or the saline?
Well, again, we're getting into kind of aesthetic choices and such. I think they're both good implants. I think the silicone's a good implant. I think the saline's a good implant. Depends what you're going for. People will argue that the silicones are a little bit softer, so if it's important to you how things feel, I would push people a little bit more towards the silicone. Silicones are a little bit more expensive, and so sometimes there's a price point issue, and so some folks would go for the salines. Some people also like how the salines stand out a little bit more. So again, you have to individualize it for the patient.
And then you have to make a decision. You want it below or above the muscle, and we don't have the time to really, I guess, talk about that, but that's why you need to talk to your plastic surgeon. You can reach Dr. Roth at, what's your website?
Website is jjrothmd.com. And we have lots of information there. We have cartoons that explain procedures, befores and afters. And we also have a page that says check their credentials. So by all means, even if you're not going to go with me or I live too far from you, use that page to check out whoever you want to. It has all the 800 numbers, and it also has the website numbers for all of those.
Remember, the new you must be done by a board-certified plastic surgeon. Thank you, Dr. Roth.
My pleasure.
Okay.
Thanks for having me.
Be sure to visit us online for more information about today's guests, to see past shows, or even contact us about being on the show. Simply go to theedbernsteinshow.com. That's theedbernsteinshow.com.
Hard work has built this city. If you've been hurt at work, do you know that you can choose your own doctor? Call me even if you received a PPD rating. I'll protect your workers' compensation rights.
Turn to someone you can trust. Enough said. Call Ed.